All right, my name is Rose Kresmian, and this is my policy brief presentation. Having looked over all of the materials that we discussed in class, such as Medicaid, Medicare, Social Security, etc., other policies that benefit older Americans, I really wanted to discuss more community-based programs that are offered to older Americans. Having worked at a community center myself, I noticed that a lot of the programs that were being offered were not only very minimal and basic, but also were only advertised online. So there were a lot of older individuals that weren't knowing about these programs, therefore they were being cut. In 1965, Lyndon B. Johnson proposed the Great Society on not only benefiting the poor and getting them out of poverty, but that also affected older Americans at the time, since they were considered one of the poorest groups of people in our country. Nowadays, even though we do have more funding from Social Security and Medicare for individuals to be able to maintain the basics after retirement, a lot of them are going into assisted living places. Not a significant amount, but there are a lot. And it does cost a lot of money to be an older American nowadays. On average, it costs about $3,550 for an individual to just have the basics in an assisted living place. And furthermore, it doesn't take into account extra costs that may happen from a broken hip or even other care. There are a lot of there are a lot of larger cities that are implementing programs to provide health care, meal services, as well as counseling for older individuals in the home. Especially since there are a significant amount of older individuals who are living by themselves at home, it's important that not just the government, but the community level is making sure that these policies and needs are being met of the older population, especially since this shift is occurring. There is a proposed shift from 13 to 19% of the older population that's going to increase in almost a 20-year span. And that's a rapid change compared to a lot of other population groups. So as part of my policy brief, although there are proposed ideas to make changes in order to meet the demands, I think one of the things that we have to consider is look at our own communities. I mean, we're one of the rare groups that's interested in geriatrics and gerontology and really looking across the lifespan and not necessarily just looking at the young or the healthy or the abled. And we really need to take those skills not only as gerontologists, but also nurses and businessmen and regular everyday people who want to give back to their communities, even on a volunteer basis, especially if you live in a small community. Especially where I went to college. We had several communities that I visited before where older Americans weren't getting social interactions because they didn't have anything nearby. So in order to make this shift, it's not just about money, but it's about setting policies and programs that wouldn't necessarily take a lot of money in order to not only meet the social needs of the older Americans and keep them in their homes, but also help them maintain healthy lifestyles and social interactions as they age.